Hi everyone, welcome to Facebook Live. Today we are going to be talking about the 5 S's. I'm Melissa Gersin, founder and CEO of Tranquilo Mat. I am a maternity nurse with 6 years of experience, and I have worked in some of the biggest Boston area hospitals, and I have had experience with thousands of babies. So I am going to be helping you guys through the 5 S's and giving you all my tips and tricks. So if you've ever wondered how those nurses in the hospital got baby to be so quiet and calm and sleep so well, and you get home and you're having trouble, then you need to watch this video. If you know anybody who should be watching this video, feel free to tag them and ask them to join, because they're not going to want to miss some of the tips. And if you can hear me loud and clear, please go ahead and push the one of the smiley face emojis or the heart emojis. So thank you. All right, so let's get started. First and foremost, the 5 S's is based off of the Happiest Baby on the Block and mimicking the womb. So this is Harvey Karp's, one of his famous techniques that he started to come up with a few years, probably about 20 years ago, I think now, and he wrote a famous book about it, and it's all about mimicking the womb and experiencing what it's like in the womb. And these 5 S's are swaddling, sucking, side or stomach lying, shushing as well. I think that was it. Maybe I missed them. Hold on. Swaddling, sucking, side or stomach lying, swaying, or shushing. So those are the 5 S's. It's always like the 7 dwarfs for me anyway. I always forget one there when I'm trying to rattle them off. Yeah, and it's about mimicking that womb experience. So, so these theories have actually been proven now by a recent study in the Journal of Pediatrics, and they tested over 200 2- and 4-month-olds. They had trained the residents at a children's hospital in Virginia these techniques, and then they rated the babies on fussiness before their vaccinations and then after their vaccinations. So it was really, proven that these techniques do work. So hopefully you guys are going to get some great value out of these. So the first one that I wanted to go over was swaddling. Swaddling is really common. A lot of people know about it. Every baby in the hospital is born swaddled up. You see the nurses do it. Why that is helpful is because babies are so tightly packed in the womb. When you think about it, you probably felt them kicking your bladder. Go ahead and give a like if you remember them kicking your bladder or poking you in the ribs. During those last few months, they don't have a ton of room or space, and so they're really kind of snug up. Their hands are up by their face, and they've got no place to go. And as you felt them kind of pushing their way here or there, you probably felt like they were playing soccer inside your belly, but really they were probably just moving maybe like an inch because it's just so tightly packed. So swaddling is trying to mimic that kind of nice tight hug that the baby is feeling when they're inside the womb. And most babies enjoy being swaddled. I would say probably 9 out of 10 babies really enjoy being swaddled. When your baby is first born, you should have their arms down in the swaddle so they can't really get access to their hands, because that way the swaddle will last longer, and those babies don't need their hands when they're being swaddled. So if you're just tuning in, again, this is the 5 S's, and we're just starting talking about swaddling. So newborn babies, you can swaddle their arms down by their sides. Often when babies are born, they're actually literally still, their muscles are like this. So how are you supposed to swaddle them down like this? You actually want to take your hand and gently apply pressure, and eventually, after about a few seconds, they will relax their arm, and it'll be super easy. They'll kind of go limp, and you can bring that arm down, and then you'll wrap the swaddle around. I have a baby swaddled right here. Fake baby, obviously not a real baby, but we do what we can. So this particular swaddle, when the arms are down, you can see that the baby's arms are more here. And this swaddle is kind of that classic swaddle. So the key to swaddling, even if you're going to tell me my baby doesn't like to be swaddled, is actually they do. I can almost guarantee that your baby does like to be swaddled. And the reason why babies often seem like they don't like to be swaddled is possibly because they're not tight enough. So the key is to have it so you can only fit 2 fingers in between the swaddle and their chest so that they can breathe easily. Other than that, it should be tight, 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 tight. So think about how your maternity jeans were in those last couple weeks and how you could barely put your fingers in to the front of it. That's exactly how you want that swaddle to be. And when you think about fabric, almost every single fabric has some kind of give. So when you're pulling on a particular fabric, it actually does kind of pull and go with you. So it's almost impossible to swaddle a baby too tightly. So you want to make sure that that swaddle is really, really tight. Because of the camera, it's going to be impossible for me to show you how to swaddle, but this is just one of 4 techniques of how to swaddle a baby. This is kind of that traditional classic hospital swaddle, but you'll notice, like I said, the arms are in tightly. And then this is actually the other end, which came over. See, so this one came over and around this way. And then there's a bottom piece that was brought up right here. So this was the bottom. And this is the other side. So baby's arms were down and you come across. The trick and what you saw, the reason that baby was so nicely swaddled is because I put the rest of the fabric all the way under the baby's back. So that the baby's weight is actually holding that swaddle into place. And you want to make sure, again, it's tight, tight, tight. So, and then you can bring the bottom piece up, and then you'll bring the other side around. Obviously, this is a very poorly loose swaddle. This would actually be a SIDS hazard in a crib, so you wouldn't want to have a loose swaddle. You want to make sure that it's really tight. So make sure that that is the case here, guys. And if you want more details, like I said, this is one of about 4 different types of swaddles that I know of, so please tune in next week. We're going to be going into real depth of just the swaddle next week. So I will show you all 4 different swaddles. We'll have a much better camera angle so you guys can see the nitty-gritty of how swaddling works, and kind of these 4 different techniques, and also we'll dive in some more into these details. So that was swaddling. Again, tight swaddle, arms down when baby is first born, and then as your child grows, you can start to leave maybe one hand up or then both hands up. This is as you're trying to wean your baby off of swaddling. So just keep that in mind when you are swaddling. So that's kind of the overview of swaddling. Again, a lot of parents might say that their baby doesn't like to be swaddled, but they actually do. And so if you are one of those parents that says, no, my baby doesn't like to be swaddled, I will have more tips and tricks for you next week. So be sure to tune in. But long and the short, tight, tight swaddle, and then don't forget, if your baby is still crying after they're all swaddled up, it doesn't mean that they hate the swaddle. It just means that they need a few of these other 5 S's to, calm themselves, or to be, just to kind of to activate that calming response. So don't think just because you've swaddled your baby and they're still screaming that they hate to be swaddled. We'll get into that a little bit more next week. One of the other S's, if you're just tuning in, again, this is the 5 S's. We just finished going over swaddling, so you guys can watch the video after we post it. You can go back and look at that, and let us know where you're tuning in from today, so we can know where you are, what you're up to, and also let us know how old your baby is. Because we would love to know who our viewers are and how we can help you guys. So, the 5 S's, we just did swaddling. Next is sucking. So obviously babies eat, they eat from a bottle, breastfeeding, they obviously get their nutrients. It's very calming to them. Breastfeeding, bottle feeding, doesn't matter. They are just loving to suck. And every parent knows that. Even in the womb, sometimes their hands are up by their mouths and they are trying to suck their thumb, although they're not very coordinated. So they're often just, when they come out of the womb, you'll see them they just hit themselves in the face instead of trying to suck their thumb, but they do practice sucking and swallowing even in the womb. So it is a very calming experience to suck. And that is why pacifiers, everyone knows about pacifiers. You either use them or you don't. You love them or you hate them, but that's a very common technique. So a lot of parents know, well, we're going to try the pacifier. Baby's crying, let's pop a pacifier in his or her mouth. And pacifiers are great, but a lot of parents these days are also hearing that they should not be swaddling their babies, not swaddling, I'm sorry, they should not be allowing their child to use a pacifier if they are breastfeeding. And the reason for that is because this nipple confusion, that if you let your baby suck on a pacifier, same reason why often when you're first starting to breastfeed, you don't want to introduce a bottle right away. You want your breastfeeding to be well established, so baby is breastfeeding well and taking on weight and those types of things. And when you are working with the pacifier, some babies actually either like the plastic nipple sensation, or the same with a bottle, or they get used to that and then they have more of a difficult time breastfeeding. So if you were told not to use a pacifier and you're breastfeeding, you could actually try it, but if your child then after using the pacifier or a bottle starts to have difficulty latching with breastfeeding, I would consider your child sensitive and I would leave the pacifier off the table for right now, or the bottle, and just kind of leave that and come back to it. And then, so there are multiple different kinds of pacifiers and the types of plastic and the shapes of them. So you could always try a different type of pacifier if you wanted your kid to, use the pacifier and help with their sucking. But, of course, you can put your baby to the breast at any point, or give them, you don't want to give them a bottle if they've already eaten, but breastfeeding, you can have your child just what's called non-nutritive sucking. So they're just sucking to calm themselves, as opposed to sucking to get food. So that is the sucking in the pacifier. But what if you are breastfeeding and you want to try this technique? Or let's say you're not home, you had to run an errand and your husband or your partner or a family member is watching the baby and you're no pacifiers. What can you do? Big trick is to use a finger. So as long as your finger is clean, you've washed it, you've sung your ABCs, washed your hands, you put your finger into the baby's mouth. You want to put the soft fleshy part in towards the top of the mouth. So you want it to go in this way. And you'd place it in, and I want everyone to take a moment and feel the back of your mouth with your tongue. You can, if you want, you can use your finger as well. It's very soft back there. That's the soft palate. The hard palate is kind of more towards the front. In order for a baby's sucking reflex to be activated, so babies don't actually learn to suck, it's a reflex that they're born with. How smart of the universe and nature to provide babies with that reflex. So that soft palate is what actually has to be stimulated in order for that reflex to be activated. So if you're trying to get a baby to suck either on a bottle or a pacifier, or in this case on your finger, you actually need to stick, or even if you're breastfeeding, you need the nipple or the tip of your finger to touch the back, that soft part of the palate. So right in between the soft and the hard part of the palate. If you've just felt what I'm talking about, go ahead and leave a little heart emoji or a wow emoji if this is kind of the first time you heard of this. And yeah, so you're going to go back. I'm not going to do it because I might gag myself, but plus you wouldn't be able to hear me talk. You put your finger all the way into the back and you start to stimulate in where, like I said, the soft and hard palate. And when that happens, baby will automatically start to suck. And it's this kind of like this action with their tongue, and you'll feel it. And I've had so many dads, when they try this for the first time, they're like, wow, they suck really hard. That's hurting my finger. So, you'd be surprised. And it's a great technique to use for the parents who are breastfeeding or who don't want to introduce a pacifier right away. Or you've tried a pacifier and then your kid can't breastfeed afterwards. So That's a great, great little technique, and that is sucking. So that helps keep babies calm because, like I said, it reminds them of being fed and breastfeeding and bottle feeding, and so that's a really soothing thing for them. And we just did swaddling, so if you're just tuning in now, don't forget, if you've learned any great tips or tricks during this video, or if you're tuning in later, go ahead and don't forget to tag a friend who needs to know some of these tips and tricks. So, you know, get them to watch because I want to share this with the world. So the other S that is also, most parents know about this, is constant motion or swaying. So a lot of parents might have swings, vibrating chairs, maybe you have a Tranquilo Mat, that's great. All of these kind of have the constant motion. So why do babies like constant motion? Well, think about it. They are inside the womb suspended in amniotic fluid. So they're suspended in water. Every time mom moves, so even if I just do this, baby is suspended in water and they're moving. Switch back to the other, you know, you move your weight again and they're moving again. So every time you move, if you cough, you hiccup, you know, if you've got a rumbly tummy, they might be feeling some of that. So babies are constantly in motion all the time. And that's why when they come out into this world, they miss that constant motion. So a lot of parents instinctually will be holding their baby and they'll be bouncing up and down, they'll be swaying side to side. A lot of parents get rocking chairs or those gliders, and you know, they buy a swing, like I said, vibrating chair, maybe a Tranquilo Mat. All of these are kind of mimicking that constant motion. So one of the tricks to constant motion that I think is really important that a lot of parents miss, and of course we never want to shake a baby or harm a baby in any way, but think about being inside, you know, a water balloon and you're running to catch the bus. Or, well, you're holding a water balloon and your baby's inside, you know, inside the water balloon and you're running to catch the bus, I guess is a better, you know, there's so much motion that's going on. So if your baby is really, really upset, you need a lot of motion. So one of the things we never want to do with a baby would be to shake a baby. So that is the head and the neck are not supported and you just do this and they're kind of having that whiplash effect. That is bad. That is shaken baby, very dangerous. That is what you hear everyone talking about. We never, 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 never want to do that. Of course, you all know that. But constant motion, if we have baby's head and neck supported, we can be very vigorous in our motion. We can go any which way. We can kind of bounce up and down. We could go pretend we're running for the bus. That's the kind of motion that your baby is often missing if they are screaming at you top of their lungs. And that's the kind of motion that you want. Of course, as they start to settle, you decrease the motion, right? But at first, if they're really screeching, you want to be vigorous. You want to be running to catch that bus. You want to have that water balloon and you want to run with that water balloon. So that's the kind of motion that we're talking about. Again, the most important thing is always support their head and their body in line with each other so everything is moving together, as opposed to whiplash and shaken baby. Very bad. This bad, okay? So just again, I know I'm such a stickler for safety. Sorry about that, guys, but as a nurse, I can't help it. So you're just going to have to bear with me when it comes to safety. So that is constant motion. There are so many different tips and tricks and ways to do this. Whether you are using a swing, you might want to have the swing on the highest setting. If you're using a Tranquilo Mat, maybe you want to try it on the highest setting, those types of things at first, and then once baby settles or starts to soothe themselves to sleep, you know, then you can kind of turn it down. But don't be afraid of very, very vigorous motion, okay? I just want, you know, again, head in line with the body, you're gonna be good, baby's gonna be fine. So just think of that when you're doing your constant motion. If you want more ways to soothe your baby and get your baby calm with constant motion, don't forget to keep tuning in because we're going to go through all of these 5 S's as the weeks progress. So every Thursday at noon, I'm going to be doing another S. So we're going to break them out and we're going to go into a lot more detail and depth on each and every single one. So also just want to give a big thank you to everyone who has tuned in. If you're just joining us, again, this is the 5 S's. And don't forget to let us know where you're tuning in from and how old your baby is. So thank you guys for tuning in. And the 4th S, is the shushing. The shushing. So inside the womb is as loud as a vacuum cleaner. It is 80 to 90 decibels. So if you've ever heard the hairdryer up in your ear, most women know this, right? You hear that hairdryer, or you've turned on the vacuum cleaner, or you've got the dryer on high. It's that loud. It is shh of constant sound. Sorry for all you guys watching from work and you just got your ears blasted and your boss is like, what are you watching? That is as loud as the womb is, because mom's heartbeat is that loud. It's this whoosh, whoosh, whoosh sound. So when babies are born, we put them into a stationary crib and we tell everyone to be quiet. Be quiet, everybody. The baby's sleeping. No, baby wants that constant sound. They want that whoosh, whoosh, whoosh sound. Especially babies crying is 110 decibels. 110 decibels, and they're crying in their own ears. So if anyone is hearing the crying the loudest, it's them. So a parent who's going, shh, and the baby is screaming, not going to do anything. You guys really, really want to hold the baby like this, and you want to go, shh, right into their ear. I know it seems really harsh and it seems really like too much, but again, the womb is 80 to 90 decibels, and if that baby is screaming at the top of their lungs, you need something that's going to be quick, that's going to get their attention really quick. So you're going to have that really loud, shushing, angry librarian type sound, like shh, and you want to do it long and constant. Of course, that's super exhausting, so you can't do that all the time, especially if your baby is screaming at the top of their lungs. You know, you should notice the more you shush, they kind of, and if you're doing that constant motion together and they're already swaddled, and let's say you've got a pacifier in their mouth or you're using your finger, you've got 4 of these techniques all acting together to help get your baby soothed. So you should notice in the first of the 2,000 plus babies, I don't know, I've lost count so many years, I mean, most babies, when you add those 4 together and you start that shushing, within 10 to 15 seconds, they stop. They start to really decrease their crying or even stop crying. So again, you really want that shushing to be quite loud, and you want it right in their ear to grab their attention, because they're crying. They don't know why they're crying, but that sound, that loud sound, is going to remind them of being in the womb, and it's going to be like, oh, I remember that. Yeah, and they're going to calm down. So that is one of the greatest tips, and don't do the not going to help, not going to work. So if you found that helpful, again, feel free to tag a friend, have them join, or go ahead and leave a little heart emoji if that was helpful for you. If you maybe have been doing it wrong, if you've been just going shh when your baby was born instead of that nice loud shushing, or maybe you were an expert and you were using it, just go ahead and comment and leave us a like or a heart emoji if that was helpful for you. And the final S is going to be the side or stomach lying. And this one's a little bit tricky because we've all heard, probably ad nauseum, our doctors and nurses and everyone say babies have to go to sleep on their backs. Back to sleep is the phrase nowadays in the United States. Back to sleep, back to sleep. And everyone is so worried about SIDS, sudden infant death syndrome. And one of the reasons for SIDS is because babies sleep on their tummies, supposedly. This is the research that they've come up with and shown. So if babies are on their backs, they're safer. Again, nothing extraneous in the cribs, things like that. So back to sleep, and I'm telling you to put your baby on your side or their stomach. What? Like, is she crazy? Maybe I'm crazy, but that's for a different reason. Okay. So, so the reason for side or stomach lying, and this one is a little bit unintuitive. And you never, if your baby is asleep, you do want them to be on their back. So to be clear about that. Or if you're holding your baby, or if you're right next to your baby, literally like hands on them, you can feel that they're breathing, no trouble. They can be asleep on you. Think about in the hospital when you first bring baby, when you're for baby's first born, mom's often reclined and baby is like this. They, depending on how mom is laying, baby is actually on their tummies. So you have that constant contact though, and you can feel baby's breathing. So if that's the case, let's say you just love your baby so much and you watch them take a nap and you're watching them, they can be on their side or their tummy, but the minute, just like a kid in the bath, they are unattended, you want to make sure that they are back on their back and if they are asleep. Okay, so that's another safety piece. But side or stomach lying turns off their scare reflex. So a baby's startle reflex, you've probably heard of this, is the Moro reflex, M-O-R-O, Moro, and it's left over from when we were monkeys, actually. And monkeys, they walk on all fours, and their babies are actually suspended so babies are holding on, and so babies kind of have their arms up. And if baby felt like they were going to fall, or there was some kind of, something that was startling to them, they would actually reach out to try to grab for mom. And that was so they didn't fall off. Good thing for baby monkeys to have. Unfortunately, babies, not so helpful. The reason that's not so helpful is because babies aren't aware, and that'd be like you walking down the street and all of a sudden you have this like tick. You'd be like, oh my God, what is that? And that would actually stress you out more than anything, right? It's not that there was some kind of noise or startle something. It's that your body suddenly jerked without your, knowledge of it. So that's kind of what these babies are experiencing. Sometimes you guys know babies at first are really uncoordinated. So they're like they almost look like they're drunk and they can't bring their hands up to their face and they're just every which way. And so sometimes when they startle, they actually like hit themselves, and that's scary, of course. So in order to turn off their startle reflex, so if babies are hanging onto their moms, this is baby monkeys, right? They're on their backs, holding on, and there's something scary. If you actually turn a baby, and again, I'm supporting the baby this way with my hands around their chin, the rest of my arm along their body, you can put them face down, a little bit awkward with the camera here, but like this, or you can just turn them to their sides, right? And this will turn off that scare reflex. So nothing is going to scare them, startle them. It's not going to have them kind of freak out that their arms are moving every which way. So all of that combined with that swaddling, the shushing right in their ear, the constant motion, and you've got a pacifier. If you've got your baby like this, you could even use the finger in their mouth. You could kind of do all of them at once, and you're just going, that will calm. Like I said, of all the babies that I've worked with, I think there was one in 2000 that just did not respond to the 5 S's. So that's pretty good odds. If you're out there watching and you've got a baby who doesn't usually settle, it's probably because of just needing to kind of tweak what you're doing with those 5 S's. Just be a little bit more vigorous with, the motion, maybe set the swing up on high or use your Tranquilo Mat on high, and, you add the swaddle to your mix, even if you think your baby doesn't like it. They really do, as long as it's nice and tight. And again, the sucking, you can use a finger or a pacifier, and then that side lying and, and the shushing, you are golden. You should have your baby calm, which is the most important thing, and probably most babies, especially the younger babies under 3 or 4 months, often fall asleep pretty quickly if all 5 S's are used correctly. So that concludes the content that I had for you guys today, but what I do want to do now is open it up if there are any questions, if people want to, literally ask me anything. It doesn't even have to be about the 5 S's. It could be just anything. I'm happy to answer your questions. The only thing I will warn people is I do have to run right at 1 o'clock this week. I am catching a flight to go to Chicago, so if anyone is out there watching from Chicago, check out the JPMA Baby Show. We are going to be there this Saturday and Sunday. Some of my coworkers are going to be there. Shout out to Maria, Ashley, and Kristen who are coming with me. But other than that, I am open and available. So if anyone has any questions, even any specific questions, I am here. I've got the answers hopefully for you, and if I don't, I do promise to find them and reach back out to you afterwards. So you can literally ask me anything. Does anyone have any questions? I see that Malka had joined. I don't know where Malka joined in from, but go ahead and leave. Don't forget to leave us where you're joining in from. It looks like Shane has joined us and Alexandra. Caroline. Oh, Caroline, you're so sweet. No, you're the best for joining us. Thanks for joining in, Caroline. We have Renata. Is anyone still out there listening? Hey, maybe I did such a great job educating people that there are no questions. I also know there's a little bit of a lag, so I'm going to hold out here for a bit to see if there are any other questions. If there aren't, come next week and be prepared with your questions. Next week we're going to be talking about swaddling. Again, noon Eastern Standard Time in the United States. I'm on the East Coast. So every Thursday at noon Eastern Standard Time, we'll be going through one of the 5 different S's, and then we're going to keep. We've got Nicole joining us from Tampa, Florida. Ashley, okay, Ashley has a question for us. My baby hates to be swaddled. He always pushes his arms through. How do I stop him from doing that? Great question, Ashley. Thank you. So one of the things, again, is super, super, super tight swaddles. It's almost impossible to swaddle baby too tightly. Again, if baby's arms are down, it's much, much harder for baby to break through that swaddle. So as long as that swaddle is super tight, and I can guarantee you, if you are going to be swaddling and you think you're like pulling on that swaddle blanket and you're really tucking it under baby's body, to let the weight of baby hold that one piece of the swaddle together. You keep doing that. If you are pulling really, really tight, you think baby is way too tight, you just check, put 2 fingers, again, in between the fabric and their chest. If you can fit those 2 fingers, baby can breathe. It is not too tight. So tight, and then if you think it's too tight, tighter still, as long as you can feel those 2 fingers. So arms down, tight swaddle. And again, using the weight of the baby to keep the swaddle in place. And again, tune in next week for the swaddle. I'll give a much better demonstration. But if this is one corner of my swaddle over here, you want to bring it over, and you're going to roll baby, and you're going to put the whole rest of this under baby's back, and you can keep pulling this part, and that's tight. And then you could come up. You could leave the legs out too. If your baby's older, you could maybe leave one arm out so that they're you're weaning them off swaddling, and then, bring the other side around. But again, so that the baby's weight is holding that swaddle into place. And that really should prevent a lot of those bust outs. Of course, the longer baby's swaddled, they are moving when they're sleeping or when they're around, so certainly they are going to bust out eventually. Yeah, so that's kind of the tip, and definitely tune in next week, and I have like 3 or 4 different types of swaddles to show you. When do babies outgrow the startle reflex? Great question. I'm going to have to look that up because I never want to give the wrong answer. I'm thinking in the back of my brain somewhere about 3 months, because that's when babies start to have a little bit more emotion and they're kind of more alert and they're more awake, but I could be wrong, so I'm going to double check that fact for you guys, but they do outgrow the startle reflex, so the side or the stomach lying is not, it's still helpful, of course. Tummy time is super important, but once the startle reflex is, gone, they're not going to have as much issues being on their back for extended periods of time. So that's it. And Brittany tuned in. I don't know where Brittany tuned in from, but thank you. The 5 S's are amazing. Colic, yes, your son had colic. That is such a pain. So many parents out there struggling with that. My parents, I'm sorry, Mom and Dad, I really am, 30 plus years ago, struggled. I was a colicky baby. It is no fun, but the 5 S's can really help. So I'm glad that you got to tune in today, Brittany. So thank you guys. I think that was it for the questions for today. Like I said, next week, noontime, Eastern Standard Time, we're going to be breaking down the swaddle. We're going to have about 15-20 minutes on the swaddles, and we're going to go through several different types of swaddles. I'm going to have somebody help me with the camera so we'll get better angles. So thank you all so much for tuning in. So one last question that's just come in. Let's see. Sure. So the Tranquilo Mat, how does the Tranquilo Mat help to soothe babies? The Tranquilo Mat is working off of that constant motion and constant sound. So that swaying, that's one of the S's, constant motion, because babies are suspended in amniotic fluid, and then that loud whoosh of mom's heartbeat is as loud as a vacuum cleaner. So the Tranquilo Mat is based on both of those tips and both of those kind of S's. So that's where the Tranquilo Mat comes into play. I came up with it because I had babies in the hospital that I couldn't use these techniques on because I couldn't pick them up and hold them. So I ended up I was like, oh, I wish their car seat vibrated. I wish this warmer. I wish that bassinet. I wish, the isolette. I wish I could pick them up and do the constant motion. And so thought of that there should be this portable, flexible mat to do that instead. So that is how I came up with the concept of Tranquilo Mat and how it works and kind of ties in to this, to these topics. So thank you for that question. Thank you guys again so much for tuning in, and I hope to see you all next week. Again, come prepared with your questions. We're going to be breaking down the swaddle. And if you're watching this after, if you're watching the video that we've got saved, don't forget to like and tag a friend and tune in next week to see me live or to hear me live and to come with your questions. So thanks guys. That was great. I love you all, and I'll talk to you soon. Thanks.